The reason why you guys are getting wrecked by side effects on your favorite GLP-1 medications like Semaglutide or Ozempic is because you are using them incorrectly. Even worse, some of you are turning into some freaking zombies out there. When utilizing your GLP-1 medications with proper lifestyle interventions, you will likely not need to follow these cookie cutter templates that cause you to increase your dose every single 4 weeks. So if you don't want to get stuck into massive weight loss plateaus or turn into your favorite character from The Walking Dead, then you need to pay attention to these lifestyle interventions. My name is Dr. Jones, and for over the last 20 years, I've helped over thousands of individuals achieve lasting weight loss. And as a clinician myself for the last 10 years, we've developed a really successful, sustainable weight loss protocol. Taking advantage of these micro-dosing and intermittent use protocols is something that has allowed our patients to achieve optimal results, but ideally not get wrecked by these side effects that you guys are hearing about day in and day out. So this is really crazy. The amount of people out there taking these medications, first of all, just as a whole, the amount of people taking these medications is just amazing. You know, as somebody myself who has struggled with weight for, a good portion of my late adolescence and teenage years, which is a pretty shitty time to be fat and overweight, I'm not gonna lie. But, I lost over 100 pounds when I was 16, and, for a decade I struggled to keep it off. And so going through those struggles and finally coming out the other side has really that's really what fuels my passion and why I do what I do. But it also gives me much more appreciation for these medications as a whole, because we really understand that obesity is a chronic disease. We're going to get into this more later, but it's not the chronic irreversible disease that we are being told it is, but it is nonetheless a powerful chronic disease that's tough to beat. But we have these GLP-1 medications. We have this powerful tool now that can be utilized and should be utilized, because truthfully, when you look at the risk of staying overweight and staying obese, in my opinion, significantly higher than the usage of these medications. But that really connects to what we're trying to talk about today, right? Minimizing not only the risk of these medications, but the side effects, right? Because a lot of people just think that's just what you have to experience is some risk, and what you have to experience is some side effects. But how do we minimize that? In my opinion, the way these medications are being used incorrectly is, again, that cookie cutter template. Every 4 weeks, patients are being started off 0.25, and then it doubles, and then it doubles for semaglutide, and 2.5 for tirzepatide. Same thing, it's doubling every 4 weeks. And we're going to get into all why that is, but my gosh, if we just focused on implementation of lifestyle strategies that really just drive in and make an individual more insulin resistant. They reduce inflammation. They improve fat adaptation. The things that we know, well, I shouldn't say that we know we should do, because a lot of the stuff that functional doctors like myself preach is not common knowledge, but at least decreasing your consumption of processed foods, exercising, right? Everybody knows that we should be doing that. And then functional doctors just take it to a whole nother level. But when we get the combination down of proper lifestyle interventions and you execute on them, a whole nother scenario takes place, which the research didn't look at. The research didn't have individuals that were implementing aggressive lifestyle interventions, and so that's why they needed to continue to up their dose. It is in my strong opinion that the medication dosage is overriding shitty metabolic health. In other words, if we can improve metabolic health in other avenues, aka lifestyle, we won't need to use as much of the GLP-1 medications. And that's the big takeaway here. And again, there's no research to back this up, but I work with my clinicians, and we have over thousands of individuals in our programs. I'm coaching them every single day. My practitioners are the ones that are going to me and asking me what I'm seeing and what they're reporting and how they're reacting and what's happening with the lifestyle interventions, not the other way around, And so it's always funny when people ask me, how are you qualified to do what you do? I just coach. That's all I do, is I just coach lifestyle. That's it. And lifestyle has the mindset piece to it, but lifestyle also has the categories of things that we need to be doing better in our life. Our approach towards nutrition, eating less processed foods, eating less carbohydrates, lifestyle interventions like fasting. And that happens to be the the most controversial thing that I preach and teach, because I created a very aggressive fasting protocol in nature. And some people think it's not even, can you even fast on these medications? So we're going to get into all that. But the weight training, the resistance training, following a good supplement protocol so we're not running into any micronutrient deficiencies, like all of this plays such a significant role and really primes the body and puts it into a better condition by, again, getting to the root cause issue here. So microdosing and or intermittent use, it's all the same thing, right? Microdosing, if you never heard of it, specifically what we're talking about is utilizing doses lower than the starting doses of 0.25 semaglutide, 2.5 tirzepatide. And intermittent usage means using it less than a weekly basis. There's no data on the efficacy of using it this way. And so, as always, guys, I'm not giving you medical advice. I'm just telling you what we're doing very successfully. You have to get to that point. Most of you watching this won't be able to start most likely with a microdose. That's not going to fly. You got to fix the busted metabolisms, the inflammation, and what we can do, and what we successfully have done is kept people on very low doses, usually those starter doses. And sometimes people need to go a little higher than that. But what we do is just, this whole cookie cutter every 4 weeks is just a bunch of bullshit, and I think the bigger reason why that's happening is because most people are being prescribed from somebody who just doesn't have, either it's a med spa where there's no interaction at all. I have a lot of respect for the obesity specialists out there that are really truthfully doing their best they can, but a lot of them are just in a system that doesn't allow them to spend enough time with the patients. It's difficult, but I do have the most amount of respect for them. And while I might disagree with their notion that obesity and diabetes are chronic irreversible disease, I do respect their practice of evidence-based medicine and ultimately doing the best care they possibly can. Or even worse, some people are getting these from a research company and they're just doing it all on their own. Whatever the case may be, I'm here to tell you that we have thousands of individuals that we've implemented these aggressive protocols and all the stuff I'm going to go over with you in this video, and ultimately they're able to get away with using much lower doses, and we're able to get them to points where they can maintain weight either off the meds entirely or implementing these microdosing intermittent protocols. So let's just get into all the specifics of this, because this message needs to get out. So what is this standard protocol, right? Let's just start here. The research-backed protocol that most doctors are following is semaglutide. You start off at 0.25 milligrams. After about 4 weeks, you bump them up, you double the dose to 0.5 milligrams. Then about 4 more weeks, you double it again to 1 milligram. And then about 4 more weeks, I've seen people go to 1.5 or 2. And then usually people stop there, maybe 2.5, 2.4, 2.5. Technically it's 2.4 is the max dose, but I've seen people go to 2.5 and that's it. That's the max dose. You have nowhere to go from there. And by the way, guys, just to make sure we clarify the names, because I know how confusing it can get. Semaglutide is the active ingredient in Ozempic and Wegovy. So same dosing protocols for all three of those things. And then when we look at tirzepatide, it also goes by Mounjaro Zepbound. So tirzepatide, 2.5 milligrams. After 4 weeks, they're doubling it to 5. After 4 more weeks, they're doubling it to 10, maybe 7.5, and then same kind of concept that capping out at 15, right? So every now and then I do see some, again, clinicians practicing patient-based medicine, which is great, making individual adjustments one way or the other based off of what they see, which is phenomenal. But unfortunately, most people, that's not happening. And we talked about some of the reasons why that is. And so why is this? Why is it that everybody, these clinicians are gravitating around the every 4 weeks bump the dose, despite how wrecked people are getting by side effects? Because remember, the premise here that I'm trying to portray, my hypothesis is that it's the larger doses that are wrecking you with side effects. And I feel pretty confident this concept applies to any medication. The more medication you take, the greater the side effect profile will be and the greater risk of major complications. We know this in general, right? We have no reason to think it'd be any different with GLP-1 medications. So the larger the dose, the more wrecked by side effects. The lower the dose we can do to get the job done, the better the experience is going to be, because we can keep the dose lower. And I'm not a clinical researcher, so I don't know how they even go about researching to find the best protocols, but I'm assuming they try different protocols, and this is what showed the most efficacious results. Which, what is the definition of what they consider efficacious results? that's a whole nother ballpark, right? Because weight loss is what they were primarily looking at, but weight loss is not the end-all, be-all determining factor. We're gonna get into here shortly what the focus needs to be on if you want to achieve lasting weight loss, and that's insulin resistance, guys. Insulin resistance, which creates chronically elevated insulin levels, that's the marker that you want to pay attention to. That's the thing that if you can focus on improving, lasting weight loss will be much easier for you to accomplish. And I have plenty of other videos getting into a super deep dive into that, but we'll get into a little bit of a dive behind that. Anyways, the research, they're primarily looking at weight outcomes. And so these protocols are what get the most ideal weight outcomes with the least amount of side effects. Unfortunately, the least amount of side effects, though, are atrocious. You guys hear the stories of people getting wrecked by even hospitalizations, not necessarily for taking too much, but just in general. Extreme amounts of nausea, diarrhea, constipation, bloating, indigestion, zombie mode. You guys heard me talk about zombie mode. What do I mean by zombie mode? Zombie mode is the literal starvation mode situations that people are. I've never seen so much starvation mode. And remember, I used to manage gyms, and so we had thousands of clients on our protocols where we would implement traditional methods of caloric restriction and lots of exercise. And starvation mode was very challenging to get into because for a person to actually starve themselves, it's enough for their body to actually respond with starvation mode. Let's be clear. When we think of starvation, we think of literal locked into a basement, no food, I'm gonna die. That's starvation. But when I say starvation mode, that can be created in the body with something much less intense, but the same concept of extreme caloric restriction over time is what we're talking about here. So I just wanted to give context that we're not talking about, somebody being locked into a basement, although, my gosh, that my heart's out for anybody that ever has to endure something wild like that. The mechanisms are still at play here. Your body, essentially downregulates the metabolism. And it's not actually decreasing thyroid hormone production. It's really more decreasing the conversion of your active, your T4 to your more active T3. So you have a decrease in the conversion, you have underconversion, and then you have this increase in reverse T3, which is a marker that it's more of a stress deal. It blocks those receptor sites so your T3 can't get the job done. Not only are you experiencing a weight loss plateau, but you're also experiencing significant symptoms. The presentation, as you saw, let's not become our favorite character from Walking Dead. This is, you look at these images here, my gosh, the gaunt looking faces, the Ozempic face, the Ozempic butt, that's all one part of it. But the other part of it is the extreme tiredness, exhaustion, brain fog, constipation, feeling cold. This is just a constellation of things that happens to your body when it's trying to stay alive. It perceives this threat of continual weight loss, and it reacts by downregulating the metabolism, and aka starvation mode. So starvation mode, zombie mode is one huge issue, but then we just have all these other side effects that are ridiculous. And then we have some pretty severe side effects like pancreatitis. Now, these are much more rare, but we do have them. Pancreatitis, that can put you in the hospital very quickly. We have biliary disease, gallstones, inflammation of the gallbladder. And so again, while much more rare, these things are a big deal and should not be taken lightly. And look, the amazing other health benefits and rejuvenating benefits of GLP-1s are very real, and I'm not downplaying those. Those are amazing. I'm just talking about the real facts and the real risks here. Which brings me back to the reason why you might be watching this video is you want to minimize these risks, right? I know me and my clinicians, this is what we talk about all the time, is how can we do that? And which again brings us back to using the least amount of medication. Well, how can you do that, right? So we're going to get to all that. The people in these research studies, some of them did look at lifestyle interventions, but we got to talk about that because there's a significant difference between lifestyle interventions that are accepted in the, I would say, Western medicine umbrella versus functional practitioners have a completely different definition of what lifestyle interventions are. And I would say mine is a unique version of that. So when they say they do lifestyles, we have to understand that, yeah, I'm doing lifestyle. That's not a ubiquitous statement. Many people are doing different versions. It's unfortunately not understood. And it's in my opinion that what is considered standard lifestyle interventions, which is eating less processed foods and exercise, and it kind of stops there, getting good sleep. There's just a lot more that needs to be done. And so unfortunately, yeah, they're not doing a combination of lifestyle interventions. that are going to be anywhere near what needs to be done to actually get to the root cause, which is, insulin resistance, among many other factors. And so this is why when the research is done, people have to use much larger doses of these medications. And I'm not a lone warrior. You guys might know Dr. Tina Moore. She, it's so funny. I learned about her about 4 months ago, and what she's doing and what she believes in and preaches, I can't wait to be able to meet her, and I know our paths will cross, because, I'm just a measly little peon next to her. No, I'm just kidding. But, she's been doing this for a lot longer, and I think she's much more well known. Everything she preaches is what we were already doing. And my background in clinicians, she's a naturopath and a DC, I'm a DC, but I work with my medical practitioner. So the hormone therapy, the experience with stem cell therapy and peptides and diabetes functional approaches, we parallel. So our backgrounds are very familiar. Every word that's come out of that woman's mouth is something that we are already executing on, which is amazing. And so, there are a few other doctors out there that reach out to us all the time because they ask if I train doctors, because they're, in full agreement with what we do. And so, that's something that really, makes me happy, that there are other clinicians seeing what I see and agreeing with what I'm thinking, with what my providers are thinking. I want to talk to you a little bit about the difference between functional and allopathic. I alluded to it a little bit, but I want to get into it some more. That plays a really important part for us to really understand. We know Western medicine and allopathic medicine is very research-based, and we need research. I'm 100% on board with not making things up and executing on what we know to be evidence-based medicine. Very, very important. I just, try to remind people to understand, as humans have advanced in society due to the technological advancements and advancements in research and our understandings. We're just talking about healthcare right now, but as a whole, we also have to understand the potential bias in medical research specifically. And I've actually made videos talking about the insane amount of bias in research. I always have to be careful though, because then all of a sudden I sound like a conspiracy theorist. It's there, and if you have no belief or clue into this, then you need to do some research on your own. The takeaway is, I'm not trying to say that we need to, not believe everything. I'm just saying, keep your ears up, keep your mind open, listen to the information, do your own research, and don't be so quick to believe everything you hear, even what I'm telling you. You got to make your own decisions. When we go back to the dichotomy there between allopathic medicine and functional medicine, allopathic is going to always be significantly driven by big pharma and big money. And so it's primarily focused on what can be fixed and remedied with drugs and surgeries. There's no money for them on lifestyle. And so it's never a fair battle when we're really trying to have a discussion about what's the best method here, this drug or this lifestyle intervention. The lifestyle intervention is always going to be poo-pooed on. Lifestyle interventions, non-pharmaceutical interventions, non-surgical based methods are always going to have an insanely unfair opportunity to sort of make its own case and have fair representation if we really were trying to have a discussion to draw real conclusions about what's best for you guys. You always got to figure this out on your own. And that's why I'm so passionate. And what I'm trying to do is help you guys execute on this, right? And learn. So when it comes down to Western medicine, remember, they are looking at this in the viewpoint that obesity, we'll just talk about obesity, but diabetes and many other diseases are chronic, which I agree with, irreversible, which I completely disagree with. And I would feel very confident that thousands of functional practitioners will tell you, yeah, this is completely reversible. And then you get back to the Western, where's the evidence? Where's the evidence? Well, we already talked about why there's no evidence on it. And so I can't tell you the same kind of confidence that it's reversible based off evidence. The lack of evidence proving that it is true does not mean that we can say with equal confidence that it's not true. And I want that to sink in, because that's the thing here that I'm leaning on and helping you guys to see a potential other scenario. But because I can't prove my viewpoint to be true, you're gonna have to make your own decisions. So with the framework that many of these studies are done, they're done with that funnel and viewpoint that we just explained. And so the outcome's always gonna be pro-medication. The outcome's always gonna be pro or anti a non-medication approach. This is why the research shows what it shows, which is every 4 weeks you need to increase the dose. Because from that viewpoint, from very basic and rudimentary lifestyle interventions alongside, that's what you're going to have to do. You're going to have to continue to increase your dose. Otherwise, it doesn't work. People get some effect and it wears off, and then they double it up, and then it works again, and then it wears off, and then they double it up, and then it works again, and then it wears off. Some people don't feel anything till they get to that third titration. Meanwhile, many of them are just getting, like I said, wrecked back and forth by freaking side effects. It's just not the case when you compare it up with some nice lifestyle interventions. I wanted to touch a little bit about wrapping it all together, and then we'll get into the GLP-1s. The concept here about functional doctors, it's a whole different ballpark, right? And this is unfortunately why many people will never have access to it. It's expensive. It's very expensive healthcare because they have to spend the time. They have to do very expensive tests. And even working with patients who are able to financially afford all the expensive tests, have the time to spend with the doctors. The solution is aggressive lifestyle intervention at the end of the day. It's almost always with aggressive supplementation. I did this. This is what I did for like 5 years. And I got frustrated and bored with it because many people couldn't afford it. And the ones that could, many of them couldn't adhere to the protocols that we would need to do. I grew really frustrated with it, which ultimately got me to be bored with it. The effectiveness of it is one thing, but it's the reason why I'm so confident, and I could tell you many functional practitioners will tell you the same, this issue, obesity, just being one example of it, but PCOS, menopause, autoimmune diseases, even diabetes itself, are not irreversible. They can be reversed or put into remission, whatever you want to call it, because that's a fair discussion. Technically, those two statements are they're different. I'm not even here to have the discussion. I'll take the remission. I don't care, because some people say that's not even possible. It is. But in defense of stubborn, if you will, allopathic practitioners that will say, it's not true, it's not evidence-based, it can't be done, you shouldn't say that, who cast this dark cloud of sadness and agony when patients ask them, can you beat this? And it's like, no, you need to take this medication for life. Then they just say that, and I get it. I get why they're so poopy about it, because they're stuck in a healthcare system that doesn't give them the time needed to work with patients that, like we talked about, in a functional setting. So they never see these amazing changes. And so to them, the data says it's not possible. And the way that they're set up in the structure is it's not possible either. And so they don't see it. And so they literally, and by the way, 100% that's by design. There's no doubt in my mind that's by design. 10 years of practicing in a setting that forces you to never have enough time to see amazing outcomes. Yeah, you're first you're indoctrinated in school, and then you see these studies that are biased. Of course you're going to think this way. But kudos to all you medical doctors out there who, despite going through the research that you've gone through, are able to think outside the box and learn that, man, there's a heavy amount of bias of what I've been taught. And there's actually some natural and holistic solutions out there. Holy shit, kudos to you, because as a DC, for me, I was blasted with this information, and I already felt this way before school. But for you guys to go through the heavy amount of biased information and come out and still keep an open mind, that earns my respect. So high five to you. And kudos all day, every day. Let's dive into, exactly what these medications are really doing, because I think it'll really put things into perspective in terms of ultimately how we can get away with lower doses, getting into microdosing, intermittent usage, how we accomplish that. I think it takes an understanding of what the lifestyle interventions are actually accomplishing, the basis of the weight resistance, ultimately, what the medications are doing, right? When we look at weight issues as a whole, this is, you've heard me talk about insulin resistance a lot, and I truthfully believe this is the primary driver. We can have separate conversations, and I have posted a really awesome video about insulin resistance, so check that out on our YouTube page, like really understanding specifically insulin resistance. There's many causes. Insulin resistance itself causes hyperinsulinemia or chronically elevated insulin levels. In my opinion, the culprit behind our issues. So when we talk about obesity, we're not just talking about the condition obesity, BMI over 35. We have patients with obesity. We have patients that are just overweight. You have people that have diabetes. You have people with PCOS, polycystic ovarian syndrome. women in menopause, and various men and women with autoimmune diseases. What we know in terms of weight issues is, a lot of you are struggling to lose the weight, but many of you are also struggling to lose the weight and keep it off. And I think that's the bigger issue. And so many people are, including doctors and so-called experts, are so hyper-focused on the weight loss. And there's not enough talk about the real issue, which is the inability for people to maintain that weight. I mean, you guys tell me in the comments, how many times have you guys lost and regained the same freaking 40 pounds or, 20, 30, 40, 50 pounds in the past decade? Probably more than you'd like to admit. And, yours truly for a decade, as I told you before, it took me a while to achieve stability. That's the culprit here. This is the primary issue. This is why I focus on what I focus on, which is implementation of these strategic lifestyle interventions. And we're going to get into all this because lasting weight loss is just, I think, what all of you guys really want more so than anything is to be able to achieve stability. Whether you're able to wean off the medications is, sort of a secondary conversation, but just getting there and maintain a healthy weight, that's the goal. That's the target here. The hyperinsulinemia is a huge culprit because, we're finally understanding this, which is why the medications have gotten so popular, to begin with, because we used to tell everybody it was all about calories. It was just energy in versus energy out. Get off your ass and put down the fork, fatty. It's like, it's just literally what people have been led to. This is what we all grew up with for the past 40 years. But we know that's not the case now. And understanding just a little bit of what the issue here is. So hyperinsulinemia, why is that such a problem? Well, what does insulin do? So insulin is the primary storage hormone in your body. Insulin is responsible for storing glucose, sugar, carbohydrates, but fat and protein, all macronutrients, all things that we consume as humans that have energy in it that we can use, comes from either protein, calories, fat. I guess you can make an argument for alcohol too, because we do get energy from that, but nonetheless, primarily these three macronutrients. And so hormone is the primary driving hormone for storing the energy into your cells, causing growth. It causes growth. You don't grow without insulin. This is why type 1 diabetics, if you look back in history, were very emaciated and very malnourished because we didn't have insulin prior to whatever early decade in the 19th century. And I want to say 1912 or 1920, somewhere a long time ago, we figured out how to make, mass produce insulin. And, type 1 diabetics had a whole different outlook. Many of these people were dying really, really young and of really, really poor health. And then you look at type 2 diabetes, which is a completely different condition, but essentially it's very, very high levels of insulin because it's late stage insulin resistance. So very elevated levels of insulin, and insulin resistance, the primary driver behind that, and we notice heavy amounts of weight. And I talk about this in many other videos, but the primary takeaway here is that insulin is extremely potent at causing growth. I want to give you guys just a little example here. Bodybuilders, many of which will actually resort to injecting insulin to help them grow muscles. It's crazy. But despite how dangerous it is to inject insulin when you're insulin sensitive, right, as opposed to a type 2 diabetic, they can still OD on insulin from injecting too much. But for a very sensitive bodybuilder to insulin, this is very dangerous. They have to be very, very careful with how much they inject. But boy, oh boy, will it help grow muscles. It grows everything, fatty tissue as well. It gets really confusing to make sense of this, because I thought it was just an energy, when it comes to weight loss, the biggest and most robust studies that we have on energy tell us that despite the actions of insulin, when calories are controlled for, whatever you did to the insulin didn't matter, and you get the same amount of weight loss. You get the same amount of fat loss. I need you guys, because I can't get into it in this video, to check out my podcast that I did where I discussed my current theory as to how we are currently misinterpreting the research. Basically, I'll just give you the quick summary. I think that the largest randomized controlled trials that demonstrate that it didn't matter whether you did fasted or, keto, which would be the two primary lifestyle interventions that help lower insulin levels, it didn't matter. Fat loss was the same. So you got a lot of people out there that don't really understand the research, but they know how to read. And so they read the conclusion and, You have a lot of people like that, and you also have very respectable individuals out there that are very well educated, and the way they're interpreting this research is that it doesn't matter. You don't have to do keto, you don't have to do fasting, because it doesn't matter. The insulin doesn't matter, right? Yeah, we see something very, very different in the clinical setting when you do account for insulin. So it's my current theory that we're misinterpreting the research and that we're misapplying those research studies, and we're assuming that in the real world, you would be able to get into a caloric deficit by sheer determination, just like those studies, and voila, weight loss. Those studies, because they were so tightly controlled in a metabolic ward, people were forced. It was controlled to be able to eat in the deficit and stay in the deficit. My gosh, if it was only that easy to say, I'm going to eat less food, and presto, I ate less food. There's a little thing called hunger, and hunger is a powerful cue, and it overrides you. And this is why we know food chatter itself is such a huge issue, and why these GLP-1 medications are so amazing. The effects of elevated insulin levels can drive hunger cues through the roof. It could also slow down metabolic rates over time. So on the short term, these studies look like weight loss is identical, but in the long term, I'd argue that you wouldn't see the same thing. This is why all long-term research ever done on weight loss, anybody who's ever lost weight short-term ultimately ended up gaining it all back. I think it's due to the functions of chronically elevated insulin levels, which you won't fix without fixing insulin resistance in most cases. So insulin resistance, again, I have other videos. We got to keep on track with what I want you guys to take away from this video, which is maximizing your results, minimizing the side effects. But I just want you guys to understand that's what insulin does. When we give people these medications, we're reducing food chatter, and we are putting people into an energy deficit, which we know has a ton of benefit on its own, promotes fat loss when you're in an energy deficit. And that itself, caloric restriction, helps improve insulin sensitivity, reducing insulin resistance. But the medications themselves also directly act on the pancreas to reduce insulin resistance. Pretty amazing. By doing that, we get this instantaneous improvement in insulin resistance, and we get this instantaneous reduction in food chatter. The patient can get this instantaneous, relative instantaneous, because you got to hit the clinical dose for the patient, right? Which, remember, I believe the more metabolically busted, inflamed, stressed out individual it is, the higher the GLP-1 dose is going to be before they even feel it. And the more often you're going to have to continue to increase the dose, because it's that metabolically busted scenario, which is why the patient develops resistance to the medications quicker, sooner. And we got to keep increasing the dose, This is why the research shows that, right? We know this is actually happening, which is why the protocol is what it is. But I'm making a case for microdosing. I'm making a case for intermittent usage. And what we're doing is aggressive lifestyle interventions that focus primarily on healing insulin resistance so that we can get the outcome of lowering those elevated insulin levels, aka hyperinsulinemia. The other aspect, which I think really is important to understand, is that reduction of food chatter. Like, how do the GLP-1s do this, right? How do they, like, what is hunger? What is hunger? And more importantly, how does a patient end up executing a proper diet? I look at this as from three different angles, right? Number one, just what is their understanding of what they should be eating? That's kind of its own side category. So, like, what is the definition of ideal eating? Okay, great. There's something to certainly be said about that, but everybody agrees eating less processed foods is ideal. There's a lot of discussion about whether or not we should be going keto or not, but that's sort of side. The two main aspects about hunger is, okay, now I know what I should be eating. How motivated am I to execute and implement these changes? Because I'd love to eat a pizza every single day of my life because I love pizza, but I don't do it because I know it's not good for me. But if I could eat pizza every day, I'd probably get sick of it, but you get my point. My gosh, it depends though. I'm not a stuffed crust guy, but if we're talking about bacon, pepperoni, mushrooms with a nice garlicky crust, talking well done with extra sauce, I'll have some pizza on my cheat day this weekend. But when we're talking about executing on a good diet, there's the two variables are how motivated am I to execute and override my desires to not be on the diet, to eat shitty food. And then number two, what is my body doing, right? What is the resistance to executing the diet? How much food chatter and food cravings do I have, right? Because if you have a high amount of food chatter, you can't mindset your way over it unless you have David Goggins' mental toughness, which understand that I think that's a huge variable of it. And that's why a lot of people are able to achieve lasting weight loss. And that's what the data actually shows, by the way, is that they are very mentally tough. But for most of us, that we just can't rely on mental toughness alone. So it's the body. It's getting the body to decrease the presentation of symptoms, less food chatter, less hunger. The result, like where this comes from, is hyperinsulinemia. Because remember, we talked about insulin being the strongest growth signal. If you're constantly in growth, your body is not in degradation. It really can't do it effectively at the exact same time, which is why those elevated insulin levels block the mobilization of free fatty acids. So if you are constantly trying to grow, your body's going to constantly require energy to grow. So your body's set point, the balance is steered at a higher level. So your body wants to constantly gain weight, right? That's that weight set point theory. You're constantly hungry and you're not able to access the stored body fat, which is why you have all that fat on your body and you don't have the energy to utilize it. You wake up very tired. You're always hungry. This is insulin resistance. This is why these medications are so amazing, because they really reduce that and improve a person's ability to override all that nastiness and again, execute. So you put that together and you see why this is such an amazing recipe for success for anybody. But now we get to the part of the dosing. So many individuals out there that are not executing aggressive lifestyle interventions, which is where we're going to end today's video on, are in a metabolically busted state. And so they're having to override this with constant needs to increase the dose, and get wrecked by side effects. So what can we do? What is it that is the end-all be-all ultimate solution here for lasting weight loss and minimizing side effects by utilizing lower dosing? You unfortunately got to pay so much more for the high-quality organic foods, which sometimes aren't even that much better, but many times they are. But when we talk about foods that most people are buying, your health is nowhere near the discussion regarding various ingredients that they're cooking up. It's taste and it's cost at the end of the day. And so, we pay the price. And so I don't think it's realistic to say, let's go 100% clean, which is why I always focus on, let's go partially clean, right? Let's go 90-10, 90% clean, 10%, eat whatever you want. That's your junk food. That's your cheat meal. Depending on how many meals you're eating a day, you got to figure the math or per week, you got to figure the math on that. But if we could just get into a 90-10 rhythm, I think most of you would do really well. So paleo, Mediterranean are the first categories that come to mind. But truthfully, any unprocessed food, probably some foreign foods that we're not thinking of, will do really good for you. And just remember, we got to get adequate protein. Protein's kind of its own category, but since we're talking about it, anywhere between your target weight and your current weight in grams of protein would be the ideal intake of protein. Now, the second part of diet is eating less carbohydrates. So we think of keto, and we saw how powerful and amazing keto was. It just wasn't sustainable. The underlying theme of everything that I do in my program and what I preach is ensuring that it's the most sustainable format, because I got to do it with you guys. I'm going to have to do it for the rest of my life, because I have what I believe to be is the obesity gene, because my fiance has made that very clear. Just she'll watch me eat after a busy day, and she looks at me and she gives me that look, and I'm like, whoa, I don't even realize it. She says I eat like I haven't eaten for weeks, and I'm just like, just helping me realize this. And I notice what a difference when I take a microdose of the GLP-1 just completely changes. I can actually conversate when I'm eating. That's the other thing, is she'll tell me like, babe, you're not even talking, you're just stuffing your face. I'm like, this food's really good, but it's interesting. It's really interesting. And I'll do a microdose of GLP-1 and I'm eating, but I'm not so like animal style hedonistic focused on consuming food. I can conversate. I can enjoy the moment. I don't care how much I consume in the meal. I can socialize more. It's really fascinating. So I think I have it. It just never ceases to amaze me how much better I can feel when I'm on a small dose. But nonetheless, the carbohydrates, so we're talking about here, if we go keto for the next, 3 to 6 months, pair it up with everything else that I'm talking about, you're going to do really well. So maybe you'll be more motivated if you hear me out when I say it's not for life. I just want you to go keto for the next 3 to 6 months. If you haven't gotten a fasted insulin and C-peptide, that's a really good marker to see where you're at now, and then you can check where you're at in the future. The more and more those markers decrease, the better your insulin resistance really is. It really could be that simple. So eating less processed foods, eating less carbohydrates, give me like 50 to 60 grams of net carbs a day. I'm good with that. The days that you're not doing long fasting, which we're going to talk about next. So remember, total carbohydrates minus fiber, that's how you get the calculation for net carbs. We got the diet. Diet stuff's down. Number 1, number 2. Fasting, baby. Welcome to the FLOA protocol. FLOA, fasting like our ancestors. What I created is structure where structure was missing in the world of prolonged fasting. I truthfully think that fasting is the most powerful intervention. I say it after diet, but I honestly could go back and forth on the conversation of what's more powerful. And I think it depends on the individual. Some individuals with serious gut sensitivities, the removal of certain triggers like gluten, for example, in a celiac patient is probably going to be a bigger impact. But I think as a whole, fasting is just amazing. But we're not talking about intermittent. Intermittent is great, but intermittent is drops in the bucket compared to the gains that can be made with long format fasting. Long format fasting is where the magic really happens. And so what we do is we get our patients into the rhythm of being able to fast for 36 hours, sometimes even 48, continuously every single week. See, the problem with the long fasting, you get into 3-4 day fasting, is metabolic downregulation. Your body goes into starvation mode. Doing long fasting 3 to 4 to 5 to 7 days, a couple times a year, great. I'm all for that. But you can't base your weight loss program off of doing that. You need something continual. And so what I figured out is what's the longest period of time most people could fast continuously on a weekly basis, where we can then offset, the other 5 days, get into a feast, if you will. Now, we're not feasting to make up for the 2 days, but we're feasting to make sure we hit at least our TEE, which is total energy expenditure, the amount of calories we should be eating on an average day, which I'm going to tell you for most people is about 2,000 calories. By doing it this way, we can avoid the metabolic downregulation altogether. At least that's what I've seen. I still get some people that plateau out, but it happens much less often. But we can avoid that in most cases, and we get the amazing benefits of fasting. And I think that, to me, as you've seen how confident I am regarding insulin resistance and hyperinsulinemia being the primary issue here. And so this is our very potent solution, is restricting our eating window and lowering the insulin levels, and doing that for the entire time when you have weight to lose, or at least for most of your weight loss journey. Because remember, weight loss is easy. You could just take these meds and kick rocks and say, Dr. Jones, your program's too complicated. I just want to inject myself and I'm good to go. Do a little gym time. A lot of you are doing that, but a lot of you are finding out the hard way because you're gaining that weight back. I really think that this is the most powerful approach towards fixing busted metabolic systems, restoring insulin sensitivity, driving metabolic flexibility, reducing inflammation, and it goes on. I mean, long fasting like this, there's so many benefits. It goes on and on and on. You might be asking, well, how can I do? I thought you can't fast like that, especially on GLP-1 medication. You'd be surprised. So look, if you're on diabetic lowering medications like insulin, for example, then you got to be aware, you got to be potentially concerned, because, insulin will continue to drive your blood sugar down to potentially fatal level on its own. But GLP-1s don't do that. GLP-1s will take very high blood sugar levels and drive them down to a healthy rate. And so this is very amazing and sort of unique aspect of these medications. Now, fasting is kind of the same thing. Fasting can take very high levels of blood sugar and decrease them down to healthy ranges. But your body has innate mechanisms to prevent them from getting to dangerously low levels like hypoglycemia. Now, I very much look forward to a potential future where they can do studies, with people doing prolonged fasting regimens in GLP-1 medications. I can tell you anecdotally, we have thousands of people that have done it very successfully, no problem at all. You know, I can't give you the medical clearance, of course. You always got to talk to your medical providers, but this shit works. I got to be honest with you from what we've seen. And we're going to evaluate. My medical practitioners will do all the evaluation and they'll get into all the specifics of it. And some people have to work up really slow and some people much faster. You might be thinking, that's crazy though. The hunger just sounds insane. Well, we're talking about GLP-1 medications, guys. We're going to make it easy for you with the GLP-1s, right? And there's another peptide that also help a lot called AOD 9604, but you can also get the same benefit from the growth hormone secretagogue. We talked about metabolic flexibility, which is the ability for your body to tap into stored body fat. Accessing stored body fat is something that we explained is a skill your body sort of loses when it's insulin resistant, right? So giving your body the peptides like AOD, for example, it instantaneously improves the ability for your body to tap into that stored body fat, which is the huge demand that you're asking your body to do with the long fasting to begin with. And so what's really awesome about this is the combination of the GLP-1s and the fat mobilizing peptides. We're creating a really safe scenario for your body to very quickly get into some aggressive fasting protocols that are extremely restorative and healing in nature, but would be rather difficult for most people to adhere to without the medications and peptides. And we have people doing this with supplements as well, but it gets harder. And so ideally use these options. I have hundreds and hundreds of videos telling you how easy this was and how powerful the results have been. So the next one is weight training, guys, resistance training, and ultimately protecting your muscle mass. This is so important because with any weight loss journey, you're going to lose muscle mass. And so what we're trying to do is we're trying to minimize muscle mass loss. Minimizing muscle mass loss is extremely important for long-term lasting weight loss. Muscle masses are the organ of longevity. You just straight up live longer the more muscle mass you have in your body. You know, it's the organ of your metabolism. You know, your muscle mass, your muscles are like sponges for glucose. You have two areas your body can store, your liver and your muscles. So the more muscle mass you have, the larger the amount of carbohydrates you can consume before the damage happens. The damage being elevated blood sugar and elevated insulin and ultimately insulin resistance. Now, I'm not telling you to get muscular so you can eat more carbs, but I'm certainly telling you that you can eat more carbs by being more muscular. And so you do with that information what you want. But I'd be lying to you if I didn't say a good part of the reason why I like to be very muscular is because I like to eat. That's the obese gene that I was talking to you about earlier. I don't know if I really have an obese gene, but it certainly seems like it because I literally put on muscle mass because I love food. Always have, always will. And I just have to deal with it. But it's pretty awesome. Pretty awesome that I get to eat a lot of carbs, especially when I'm actually trying to build muscle mass, which I don't do too much more. I'm pretty happy with the amount of muscle mass that I have on my body. I might do some certain areas, spot reduce. I try to pretend like I'm a bodybuilder and I want this aesthetic physique, but I ain't got no time to get into a bodybuilding competition. I'm too busy creating this content for you guys out there and running these clinics. Maybe one day Dr. Jones will execute on his desire to go on stage and compete. But quite frankly, it's kind of boring, you know? But yeah, we want to build a more muscular physique for all the benefits. And so for you, the focus needs to be protecting your muscle mass. And the way that you protect your muscle mass the best is with a weightlifting regimen that focuses on hypertrophy. So this is important to understand because many fitness enthusiasts will tell you, well, to get the best of both worlds, let's do a very circuit style, almost CrossFit style list approach, short rests. Don't get me wrong. Those are some grueling, ass-kicking workouts. They can be, at least. I'm all for that for the benefit of the cardiovascular aspect of it too as well. But there's a reason why bodybuilders do not do those kind of workouts to build muscle mass. What they're doing is hypertrophy-style resistance training, where the rest periods are not that short. They're not that long either. The sweet spot seems to be about 60 to 90 seconds, maybe 2 minutes at the most, where, as always, you're lifting to complete muscular failure. So this whole concept of lifting heavy weights is not actually true. You don't have to lift heavy, but weight is the easiest variable to manipulate to bring the muscles to muscular fatigue. Because when you think about it, this is what you're doing with an exercise like the bench press. When I say muscular fatigue, that means you can't perform a single another repetition without sacrificing form. Because when you start sacrificing form, you start getting into degradation of your joint health, which we don't want. So while maintaining good form, you can't perform a single additional repetition. That's muscular failure. So you want to perform, you want to choose the variables, weight being the first one, right? That gets you to muscular failure between 8 to 12 repetitions. That's hypertrophy and you give yourself that 30 to 90 second rest period. So if you perform 20 repetitions, well, you're not lifting heavy enough. You could increase the weight. If you can only perform 5 reps, well, that's too heavy, drop the weight. But weight is not the only variable. Range of motion. We know now, even more so recently, that full range of motion actually is amazing for hypertrophy. And I'll promise you, when you go full range of motion, you're not going to be as strong. So full range of motion, good tempo, not blasting the weight and moving really fast and relying on momentum, but performing each repetition with a nice, slow, controlled momentum also is going to decrease the amount of weight. So tempo, range of motion, good form, and weight are all different variables that you manipulate in a way to achieve muscular failure within 8 to 12 repetitions while giving yourself 30 to 90 second rest. That's like a good summary of how you approach hypertrophy style weight training. And again, consuming adequate protein. I cannot stress that enough. Okay, the last pillar I want to talk about is just ensuring you got your basics in, your nutrients, ensuring you're getting adequate nutritional intake. So I'm going to rapid fire these because I know you guys are probably getting really, there's a lot of information. I try to keep my videos at an hour max, and I know we're a little past. Magnesium, so vitamin D, 5,000 IUs of vitamin D in the morning. Phenomenal. Magnesium. Now, I do recommend some extra magnesium because you guys are taking the GLP-1s, and I just noticed patients do better. So some magnesium threonate in the evening because it passes the blood-brain barrier, which is nice. I like the passing of the blood-brain barrier because it allows some extra calming and anti-anxiety effect for supporting better rest. And then magnesium glycinate in the morning. We know magnesium glycinate is probably one of the best forms in it, but I actually like about 100 milligrams or so-ish of each. And then essential fatty acids, EPA, DHA, you get that from fish oil. With some high quality fish oil, 2 to 3 grams a day, maybe even more if you're really, if you're diabetic. The more insulin resistant you are, the more diabetic you are, the more you should be mega dosing the fish oil. At least a gram of EPA, DHA, which you're going to get from about 2 to 3 grams of high quality fish oil. Nordic Naturals is my favorite brand, by the way. And then just a good high quality multi, B complex, possibly methylated B vitamins as well. If you are, you have the gene that means your body is deficient in the enzyme, but which would produce high homocysteine levels. If you don't know what I'm talking about, then just a good multi-B complex is fine. And then anything after that does become situational. So if at least 20 different fruits and vegetables per week, and some of you are not getting any, then you need to supplement with a good broad spectrum fiber product. So Unicity's Life Fiber, I really love because it's got a good broad spectrum of different fiber components to it as well. And so I love that one. Curcumin and resveratrol. If you do have an autoimmune disease or an or an inflammatory condition, that's very, very potent. I know curcumin is the most researched anti-inflammatory supplement, period. But I also want to talk really quickly because it's not really a supplement, but it's something to be aware of. Low dose naltrexone is a game changer if you have an autoimmune disease. And if you have an autoimmune disease, it's going to be challenging to fix your insulin resistance because inflammation drives insulin resistance drives inflammation. They're different, but they really affect each other. And so does leptin. I would throw leptin into that triage of as they both go up and get worse, they all get worse. They tend to all get better at the same time. Really interesting. I haven't been able to figure that out, how intertwined exactly they are. I just know they all get better, they all get worse, generally speaking. And so low dose naltrexone will modulate the immune system, calm down that overactive immune system, and it will significantly improve your inflammation levels. So we have to mention LDN because it's absolutely vital. And with these 5 pillars alone, guys, you would do really, really well. And there's much more. And I hope you guys are excited and enthusiastic and ready to join a community with thousands of other like-minded individuals where I do coaching like this every single week, where we give you the opportunity to implement and we help you work through that on the coaching calls because you get the ability on a Zoom to ask me whatever you want to ask me, guys. So I'll link to the coaching programs in the notes. And if you guys enjoyed watching this video, if it made sense to you with what we were talking about, check out that other video that I recently made. It's about GLP-1s and insulin resistance. I think you guys will really enjoy that. Take care and we'll see you guys later.